Hi there, and welcome to the Naloxone Refresher training. If you're new to naloxone, what it is a drug that is administered to somebody that is suspected of having an opiate overdose. Opiates can include things such as heroin, methadone, codeine, dihydrocodeine, oromorph, fentanyl, buprenorphine, Subutex. If you live within the Nottinghamshire county, Hetties provides free naloxone training. If you would like to find out more about that, so if your loved one you suspect is using opiates, as I've just mentioned some of those opiates there, we can provide free naloxone training to you. So you can call our helpline on 08000 850 941. But if you want to have a chat about naloxone, if you're outside of Nottinghamshire, do give us a call as well. We can talk through with you about that. But ultimately, naloxone can help to save somebody's life. So what opiates do is they are a depressant drug, so they act on the central nervous system to slow down the breathing. And what can happen is, once our breathing starts to slow, we can actually get to a place where we're no longer able to breathe by ourselves, and it can lead to death because of that respiratory depression. But what we're doing is providing that training to prevent that happening with naloxone. So today it's going to be a refresher. If you haven't had the core training, please get in contact with us and we can go through that with you. So just to recap for you, if you have done the training previously, so some of the risk factors that can lead to an overdose. So things to think about are if somebody is injecting their drug rather than smoking it, that can put them at a higher risk. If they're mixing other drugs, particularly other depressant drugs, such as alcohol, methadone, benzodiazepines, because then again, that can really affect somebody's central nervous system and their ability to breathe. If somebody is using alone, that can put them at a risk of overdosing because there isn't anybody around them to make sure that they're not going into a state of overdose. If somebody is changing their dealer, there can be a variety in the strength of the drugs that they're using, or if they're in unfamiliar surroundings, or if they're getting somebody else to prepare the drugs for them, they might then inject that person with a higher dose than perhaps what they're used to. Times when somebody might be at a high risk of overdose is when somebody has gone through a period of abstinence, so their tolerance has reduced. And then what they might do is they might then use based on how much they used to use. So that puts them at an increased risk because their tolerance has dropped. Or if there's been a break in use, so perhaps if somebody's coming out from prison, they could be at higher risk of leaving, of overdosing once they've left prison. Or if somebody has left detox, rehab or hospital, there's a risk of relapse there. Also, if somebody's starting to begin or end substitute medication, that can cause a high risk time. Or if there's other significant or difficult life events, such as job losses and bereavements and ending of relationships, those can be triggered in times for relapses and overdoses. So what I'd like us to look at now is the signs and symptoms of an overdose. So what I'd like you to do is watch video 1 below, which is the signs and symptoms of overdose video. So you can open that link into a new tab and watch that short video. But the things to note out for the signs and symptoms of an overdose is if somebody has a deep snoring or rasping voice, rasping noise, you have tried to wake them up, you've tried to shout their name and they're not responding at all. They're not responding to touch if you're gently shaking them, and when you're calling their name, they're not responding. You can see that they're starting to turn blue, particularly their lips and their nose and their fingertips, and you might also identify that they're not breathing. So take a couple of moments just to watch that video and join us back for the next part of this. Now we're going to talk through what to do if you find somebody is unresponsive but breathing. So you want to get the person into the recovery position. Most importantly is to make sure that their airway is open, so tilting their head backwards, lifting their chin up, and when they're laying down, and then rolling them onto their side, making sure that their airway is open. Then we want to be administering a dose of naloxone, so 1 dose of naloxone, and then calling an ambulance. If you see no change in the patient in 2 to 3 minutes, then you need to administer another dose of naloxone if required, and stay with that person until the ambulance does arrive. Remember, in your naloxone kit is a breakdown of all the steps if somebody is or isn't responsive. So don't worry if you don't remember all of these steps. Now I'd ask you to watch video 2, which is what to do upon discovering somebody is breathing but unresponsive. So now we're going to talk through what to do if you find somebody is unresponsive and not breathing. So as we've talked about already, opiates slow down the central nervous system and they slow down somebody's ability to be able to breathe. And it sometimes can get to the point where people are not able to breathe by themselves and their breathing stops. In those instances, that's where we have to breathe for that person. So what I'm talking about here is we need to perform CPR. Only perform CPR if you're comfortable or you've been trained to do this. So if you do find somebody that is not responsive and not breathing, you need to call an ambulance, or if possible, get somebody else around you to call an ambulance, calling 999. Then you need to start CPR. So that's 30 chest compressions and 2 rescue breaths. So a rescue breath is where you're pinching the person's nose and breathing deeply into their mouth until you can see their chest rising. 30 chest compressions, 2 rescue breaths. Ideally, you want to be then administering a naloxone injection. So if there's somebody else around, get them to put the kit together and get them to administer it, if possible, if they've been trained, or ask them if they can do the rescue breaths and chest compressions. So keep repeating the 30 chest compressions, 2 rescue breaths until the person has started breathing or the ambulance has arrived. What I'd like you to do now is to watch video 3, which is on the Pernoxad CPR. So how naloxone works is it's an antagonist drug that reverses the effects of the opiates. So what happens is in the brain, we've got opiate receptors. The opiate, so for example, the heroin binds to that receptor, and then it can cause an overdose if there's too much opiates in the system. What naloxone does is, if you imagine like the receptor is like the cup and the opiate is the ball that sits on the cup, the naloxone comes along and lifts that ball off that cup, so it frees up that opiate receptor. So it reverses the effects of the opiates. But what happens is, if you suspect somebody's had an opiate overdose, and in fact they haven't, and you have given them naloxone, you're not going to have hurt them. So naloxone will only work on opiates, and if somebody hasn't had an opiate overdose, you won't harm them. So, you're better to be safe than sorry. If you do suspect somebody has had an opiate overdose, do administer naloxone, because you could potentially saving somebody's life here as well. So what I'm going to talk through now is how to put together your naloxone kit, just as a bit of a refresher, and a refresher about how to administer it. There is a video below called Assembling and Administering Naloxone, so you can also watch that video as well. So your naloxone kit will look something just like this. Mine is a training kit, hence why it's open. But yours will be sealed and have a plastic wrapper over it, and it should do anyway, otherwise it might have been tampered with, and if so, I would suggest that you get a new one. So on opening it, you want to be twisting your naloxone to get it open. Inside, you'll see you've got an instructions kit. You'll have 2 needles and your naloxone here in the middle. As I say, mine's is a training kit, so I don't have any naloxone in my actual syringes. So as I say, you've got a wee instructions guide, so I really encourage you to use this, because if you think about it, it's okay us going through this step by step, but in that moment when you're having to give naloxone, it could be quite a stressful time. So just rely on this, bring your instructions out, put it next to you and follow it through step by step on how to put your kit together and how to administer it. It takes all of that pressure off you there. So I've got my kit out, my instructions out. I'm going to put that down next to me there and follow that through step by step. So what I need to do is take my naloxone out of its cradle. So it fits really well into this cradle. As you'll see, mine has no naloxone in it, so it's currently empty, but yours will be full. What I will show you as well, so you can see it's labelled 1 to 5. Those are the 5 doses you can administer. So you've got 2 needles in your box. You're given 2 needles in case one is damaged, so you've got a spare one. You want to open it and take it out of its packaging. On the top of your naloxone syringe is a wee cap that you just need to gently twist and it will come off quite easily. Pop that back into the box. Then your needle is able to pop on top. And again, that's just a screw. Really, really easy to put that on there, okay? You can then put this back into your box until you're ready to administer it. At such time as when you are ready to administer it, you want to then remove the sheath, so the cap from the needle. So give it a gentle pull off, okay? Just really careful of that needle. We're going to be administering 1 dose of naloxone, so that is to the first black line, okay? And we want to be administering it into the muscle, so ideally the upper thigh or the upper arm, and we can inject it through clothing as well. And we want to be doing it at a 90-degree angle, so a bit like a pen if we were writing with a pen. So we want to be putting it at a 90-degree angle. So putting it in through the muscle, and then we're using the plunger to go to the first black line. Once we've given 1 dose of naloxone, we want to pop it back into its box, so back into the cradle. It'll nicely fit, you'll hear it click in, and that way it's out of the way and we're not going to be at risk of needle stick injury. Now, naloxone can take around 2 to 3 minutes to work, so give your first dose, wait around 2 to 3 minutes, see if somebody has become responsive. If they haven't become responsive, we need to then give another dose of naloxone. We can give it around the same area, inject it back into the similar area as where we have done before. So then we're given the second dose of naloxone to the second black line. Again, pop it back in its cradle, see how the patient is responding. If again they're not responsive, we might then need to give another dose of naloxone. Now, naloxone, the effects of naloxone can last around 20 minutes, so somebody could go back into an overdose state after that. So it's really important that we monitor that person and encourage them to stay till the ambulance has arrived and they have had that medical attention. So as I say, pop it back into your box and close your box once you've administered it, and then this can be then handed over to the ambulance crew. After you've given naloxone, the patient isn't going to know what's happened. So once they've come round from the overdose state, they might be quite confused, a bit agitated, and even a bit aggressive. They might want to use drugs to overcome the withdrawals that they're experiencing. So what you can do in this time is explain to the patient what has happened, and be clear with them that they were in an overdose state. You were trying to wake them and they were not responsive, so you have had to administer naloxone to help save their life. Do explain to them that the effects of naloxone are temporary, they may wear off and they may go back into an overdose state. So it's really important that they stay and that they're seen by the paramedics or they have had some medical attention. Ultimately, this is that individual's choice. You can only do so much to advise and encourage somebody to get medical attention, but it is important that they're aware of what they've had and you've given naloxone to save their life. So once you've used the kit, as we say, give the injection, put it all back into your box and hand it over to the paramedics, including any used or unused needles. Don't attempt to resheath and put the cap back on the needle, because you might get an injury by doing that. And if you have used your kit and you need another one in Nottinghamshire, you can contact Hetty's, but you might want to check out your local drug and alcohol services for another naloxone kit if you're outside of Nottinghamshire. All of the kits come with an expiry date on them as well. So on the box, it'll be just on the wee white label, there's an expiry date. Just maybe have a look at that as well, because if it's close to coming to expiry, you might want to get a new one, and if it's out of date, you will need to get another one. Again, that's something that we can help you with, or your local drug and alcohol service would be able to support with. If you do have a needle stick injury, it may occur where you've pierced or punctured the skin. These are just some of the first aid steps that you want to follow in those times. So you want to try and encourage the wound to bleed, ideally holding it under clean running water. Washing it with plenty of soap. You don't need to scrub it, you don't need to be rough with it, just quite gently rubbing it. Don't suck the wound in any way. Dry it with some nice clean paper towels, if possible, nice clean towels, and put a waterproof dressing or plaster it over it. You should try and get medical attention as soon as possible, so either going to A&E or your GP or calling 111, because you could be at risk of any viruses or infections if you've got an injury. Okay, so I hope you've enjoyed the training. I hope it's been helpful for you. What I would encourage you to do is to watch all of the videos that are listed below, the links to the Pronoxad video. So just to make you aware, Pronoxad is the other name for naloxone. It's the exact same thing. Pronoxad's the brand name for it. So if you've got any questions about the Naloxone Refresher or having naloxone training, if it's not something that you have and you would like to have that training, please do give us a call. So our helpline number is 08000 850 941, or you can chat to us online at www.hettys.org.uk. Thanks for watching and take care.